Well, tonight, an all-new Defenders investigation revealing many test results not being counted in North Carolina's daily update. So we're talking specifically about the percent of positive cases. So you just heard Vanessa giving an update about today's numbers, but our team has learned the state is not calculating tests unless they're reported electronically, and about a quarter of them are not. WCNC Charlotte Defender Alex Shabbat is digging into that story. He joins us now with what he learned. Alex.
Well, the state says that tests that are not reported electronically are not as up to date. In fact, they can be from several days earlier, and that's why they aren't counted. There are several ways to take the state's pulse during a pandemic. The percentage of positive tests is one of them. It's meant to indicate the amount of COVID-19 spread, which informs public policy.
Our percent positive is still high, but it's steady.
But this is just a snapshot of the big picture. And by snapshot, I mean about a quarter of the test results aren't counted in the daily updates because those results come from labs that don't report electronically.
Those 25% that are reported manually are not included in the percent positive.
That's because when test results need to be manually entered, they are not always as up to date.
We're constantly trying to improve.
Elise Powell is with the state's Department of Health and Human Services. She tells us some labs will send a batch of manual results from the past few days or even weeks for new labs.
We really want to make sure that we're measuring positive tests and negative tests that happen from the same day.
Powell says there are different reasons why labs are not reporting electronically, including not having the proper technology.
We are working hard as a state to onboard more labs to be able to report electronically so we can continue to grow that number.
And the data is top of mind for Governor Cooper.
And they could jump higher in the blink of an eye
as he considers the next step forward. The state is also trying to improve how it tracks the total number of tests being done. Now labs are required to report all tests. Previously, they were only required to report positive tests. In Charlotte, Alex Shabbat, WCNC Charlotte.
Alex, thank you. The state tells us they have no reason to believe the 25% of tests that aren't counted would have a major impact on the overall data.